Hello and welcome, dear friends. It's good to connect with you today. I want to talk about something that can be quite frightening, something that might have happened to you or someone you care about. It's that sudden, terrifying feeling of being woken up in the middle of the night, gasping for air, feeling like you just can't get enough oxygen. Maybe you've brushed it off, thinking, oh, it's just part of getting older, or I just slept in a funny position. But if you are over the age of 70, and this is happening to you especially frequently, please listen closely. That sudden struggle to breathe upon waking is often more than just an inconvenience. It can be your body sending you a critical warning signal. It's a signal that should never be ignored. Today we're going to explore what might be behind this frightening experience, and more importantly, what 3 immediate actions you can take if it happens to you. We'll also discuss when it's time to seek urgent medical help and some everyday steps you can take to reduce the chances of it happening again. My aim here is not to alarm you, but to empower you with knowledge and practical steps delivered with empathy and care, like a conversation between friends. So, let's gently explore this important topic together. Being woken up suddenly, feeling short of breath, is not a normal part of healthy aging. While our bodies change as we get older, struggling to breathe, especially after sleep, points towards an underlying issue that needs attention. Think of it this way. Our bodies are incredibly resilient, but they also have ways of telling us when something is not quite right. This could be one of those important messages. There are several potential reasons why someone over 70 might experience this. One common culprit is something called sleep apnea. You might have heard of it. This is a condition where your breathing repeatedly stops and starts during sleep. When your brain realizes you're not getting enough oxygen, it wakes you up, often with a gasp or a choking sensation, leaving you feeling breathless and maybe even panicky. It's more than just snoring, it's a disruption of the breathing process itself. Other possibilities involve your lungs or heart. Conditions affecting the respiratory system, like chronic obstructive pulmonary disease, or COPD, and asthma, can make it harder to breathe, and symptoms can sometimes worsen when you're lying flat during sleep. Fluid can build up in the lungs, making it feel like you're trying to breathe through water. Your heart also plays a vital role. Heart conditions, particularly heart failure, can lead to fluid accumulating in the lungs and other parts of the body because the heart isn't pumping as effectively as it should. When you lie down, this fluid can shift and put pressure on your lungs, making it difficult to breathe and waking you up gasping. Coronary artery disease, which affects the blood vessels supplying the heart, can also sometimes contribute to breathing difficulties. Ignoring these symptoms is like ignoring a smoke alarm. It might be a false alarm, but it could also mean there's a real danger. These underlying conditions, sleep apnea, lung diseases, heart failure, carry significant risks if left untreated. They can strain your heart further, reduce the oxygen supply to your brain and other organs, increase the risk of falls due to disorientation, and generally impact your quality of life dramatically. Recognizing this symptom as a potential warning sign is the first crucial step towards protecting your health. So if you find yourself in that scary situation, woken up by breathlessness, what should you do right away? When you're gasping for air, panic can easily set in, making it even harder to breathe. The key is to have a plan, to know the immediate steps you can take to try and alleviate the situation and calm yourself. This brings us to the first life-saving action, and it's a simple one, but surprisingly effective. Adjusting your body position. When you're lying flat, gravity isn't helping your body manage fluid or open your airways as much as it could. For conditions like heart failure, lying flat can cause fluid to shift and pool more in the lungs, making breathing harder. For some respiratory issues, it can also make it more challenging for your lungs to fully expand. The immediate adjustment is to move to a semi-sitting or upright position. If you're in bed, try propping yourself up with several pillows so your upper body is elevated significantly. Think almost halfway between lying down and sitting straight up. Even better, if you can safely do so, sit up fully on the edge of your bed. And if possible, let your legs hang down towards the floor. Why does this help? Let's think about it simply. When you sit up, gravity pulls fluid down towards your legs, away from your lungs. This reduces the pressure on your lungs and makes it easier for them to expand with each breath. Sitting upright also allows your diaphragm, the main breathing muscle, to work more efficiently. Dangling your legs further assists by allowing some blood to pool slightly in your legs, which reduces the amount of blood returning to your heart, thus reducing the heart's workload and potentially easing congestion in the lungs. Imagine trying to inflate a balloon inside a cramped box versus in an open space. Sitting up creates more open space internally for your lungs to work. It might feel like a small change, but it can make a noticeable difference in your ability to catch your breath in those crucial first moments. Take slow, deliberate breaths if you can, focusing on inhaling through your nose and exhaling through your mouth. Your position is the first, most immediate tool you have. Now for the second action, getting access to fresh air. When you're struggling to breathe, the quality of the air you're trying to draw in matters. Stuffy, stale indoor air can feel suffocating, and it might contain irritants like dust or allergens that can worsen breathing difficulties for some people, particularly those with lung conditions. Opening a window, even just a crack, can help. The influx of fresh, cooler air can feel incredibly soothing and make it feel easier to breathe. It increases the oxygen concentration slightly and disperses stale air. Of course, be mindful of the weather. You don't want a strong, cold draft if you have a condition like asthma that can be triggered by cold air. But a gentle flow of fresh air can make a big difference. If opening a window isn't feasible or safe, consider using an air purifier if you have one. While it won't increase oxygen levels, it can remove airborne irritants, which might help. Even just turning on a fan, directed away from your face so it circulates the air gently in the room, can create a feeling of better ventilation and ease the sensation of breathlessness. Beyond the physical benefit of potentially higher oxygen levels or fewer irritants, fresh air also has a psychological effect. When you're panicked and struggling for breath, a feeling of being closed in can make things worse. Fresh air, even just the idea of it, can provide a sense of openness and calmness, which is vital in managing the panic that often accompanies these episodes. So, make sure your bedroom is well ventilated before you go to bed, but if you wake up breathless, making an immediate effort to get some fresh air is your second line of defense. The third immediate action, and this one comes with a crucial caveat, is properly using prescribed medication. I stress prescribed because you should only use medication that has been specifically given to you by your doctor for this type of symptom or the underlying condition causing it. Do not take medication prescribed for someone else, and do not take medication that is not intended for acute breathing distress just because you feel short of breath. However, if your doctor has diagnosed you with a condition that causes nocturnal breathlessness, like asthma, COPD, or heart failure, they may have prescribed you specific medications to use when you experience acute symptoms. For example, if you have asthma or COPD, you might have a rescue inhaler. This medication is designed to quickly open up your airways. If you wake up breathless and you know this is related to your lung condition, using your rescue inhaler as prescribed can be life-saving. Make sure you know exactly how and when to use it and keep it easily accessible, perhaps on your bedside table. If your breathlessness is due to heart failure and fluid buildup, your doctor might have prescribed a specific medication to take at the onset of symptoms, perhaps something to help your heart or remove fluid. Similarly, if you have coronary artery disease, and your breathlessness might be a symptom related to that, you might have medication like nitroglycerin, though breathlessness is often a symptom of a heart event, less commonly the primary trigger for taking nitro. Your doctor's instructions are paramount. The key here is prior planning with your doctor. If you have a condition known to cause nocturnal breathlessness, talk to your doctor about what specific medication, if any, you should have on hand, and use immediately if this happens. Knowing you have the right tool and how to use it can provide immense reassurance, but again, this step is only applicable if you have a specific, prescribed medication for this purpose. So those are the 3 immediate steps. Adjust your position, get fresh air, and use prescribed emergency medication if you have it. These steps are designed to give you the best chance of alleviating the symptoms quickly and safely in the moment. However, and this is perhaps the most critical point, these steps are intended to help you manage the immediate crisis. They are not a substitute for medical attention. If you take these steps, you sit up, you get fresh air, you use your prescribed medication, and your breathing does not improve within a few minutes, or if it actually gets worse, or if you experience other worrying symptoms like chest pain, dizziness, confusion, or a bluish tint to your lips or fingertips, it is time for the next most important action: seeking emergency medical help immediately. Do not hesitate. Do not wait to see if it gets better. Do not try to tough it out. Pick up the phone and call your local emergency number, 911 in many places. This is precisely the kind of situation they are there for. Explain your symptoms clearly. You woke up suddenly feeling breathless. You've tried adjusting your position and getting air, but it's not getting better, or it's worsening. Tell them your age and mention any known conditions you have, like heart failure or COPD. Getting to a hospital quickly in these situations can make a profound difference. Emergency medical professionals are equipped to rapidly assess what is happening, administer oxygen if needed, provide stronger medications, and stabilize you. They can perform tests to determine the exact cause of the breathlessness and ensure you receive the appropriate treatment. Waiting can have serious consequences. Delaying care when you are struggling to breathe could mean damage to your organs from lack of oxygen, or it could allow an underlying condition like heart failure or a severe asthma attack to escalate into a life-threatening event. It's far better to call for help and have it turn out to be less severe than feared, than to wait and have a serious situation become critical. Please, make a pact with yourself right now. If you experience this, and the immediate steps don't bring relief quickly, you will call for emergency help. Write down your emergency number by your phone if that helps. Tell a family member or neighbor your plan. Now, while knowing what to do in the moment is essential, focusing on prevention is key to reducing the likelihood of these frightening episodes happening in the first place. Living a healthy lifestyle and proactively managing your health are powerful tools as we get older. Here are some daily prevention tips to consider, approached with that gentle, guiding spirit. First, pay attention to your sleep environment. Your bedroom should be a sanctuary for rest. Ensure it's quiet, dark, and kept at a comfortable, consistent temperature. Think about your mattress and pillows. Are they supportive? Elevating the head of your bed slightly, even if you haven't been diagnosed with a condition requiring it, can sometimes help prevent breathing issues related to lying flat. Using an air purifier to keep the air clean can also be beneficial. Creating a calm, conducive sleep environment promotes better overall sleep quality, which can positively impact your breathing. Second, and this cannot be stressed enough, maintain regular medical checkups and be open with your doctor. Your doctor is your most important partner in managing your health as you age. Don't skip appointments. When you visit your doctor, talk about all your symptoms, even those that seem minor or intermittent. Specifically mention if you have ever woken up feeling breathless, how often it happens, and what it feels like. This information is crucial for your doctor to correctly diagnose any potential underlying conditions, like sleep apnea, heart failure, or lung disease, and to develop a treatment plan before you end up in an emergency situation. Early detection and management are incredibly powerful. Third, engage in moderate, regular exercise. I know it can be hard to feel motivated sometimes, but movement is medicine. Even gentle, regular activity can strengthen your heart and lungs, improve circulation, and help maintain a healthy weight, all of which can reduce the risk of conditions that cause nocturnal breathlessness. Talk to your doctor about what kind of exercise is appropriate for you. It doesn't have to be strenuous. A daily walk, gentle stretching, chair exercises. These can make a significant difference. Find something you enjoy, even just a little bit, and try to make it a consistent part of your routine. Fourth, focus on a healthy diet and hydration. Eating nutritious food supports your overall health. If you have a condition like heart failure, your doctor might advise specific dietary changes, such as limiting salt intake or managing fluid intake, especially in the evening, to prevent fluid buildup. Pay attention to these recommendations. Avoiding heavy meals or excessive alcohol close to bedtime can also improve sleep quality and potentially reduce the likelihood of nocturnal discomfort. Fifth, manage stress. Stress and anxiety can definitely affect your breathing, sometimes making you feel short of breath even when there isn't a physical cause. Learning techniques to manage stress, such as deep breathing exercises, practicing when you aren't breathless, gentle meditation or engaging in relaxing hobbies can be beneficial for both your mental well-being and your physical ability to breathe calmly. Finally, and circling back to medication, adhere to all your prescribed medications. If you have been diagnosed with a chronic condition, whether it's high blood pressure, heart disease, or a lung condition, taking your prescribed medications regularly and exactly as directed is vital for keeping the condition under control and preventing complications, including nocturnal breathlessness. Don't adjust doses or stop taking medication without talking to your doctor first. Remember, dear friends, experiencing sudden breathlessness upon waking, especially after the age of 70, is a symptom that warrants attention, not dismissal. It's your body asking for help, asking for care. You have the power to respond. We've talked about the potential reasons behind this frightening experience, from sleep apnea to heart or lung conditions. We've discussed the 3 immediate steps you can take if it happens: adjusting your position, getting fresh air, and using prescribed emergency medication if you have it. And we've reinforced the absolute necessity of calling for emergency help if your symptoms don't quickly improve or if they worsen. Finally, we've explored important daily habits, from a good sleep environment and regular checkups to exercise, diet, stress management, and medication adherence that can help reduce your risk. This information is here to guide and empower you. It's okay to feel a little concerned, but let that concern be a motivator for positive action. Talk to your doctor about your experiences and your risks. Share this information with your family so they are also aware and can help if needed. Take these steps towards proactive health management. You are not alone in this journey of aging. There is support and knowledge available. By understanding what might be happening and knowing exactly what to do, you can face potential challenges with greater confidence and peace of mind. Your health and well-being are precious, and taking these steps is an act of self-care and strength. Thank you for spending this time with me. I truly hope this information brings you clarity and reassurance. Remember to be kind to yourselves, listen to your bodies, and seek the care you need and deserve. If this video was helpful, please consider giving it a like. That helps others who might need this information find it. If you haven't already, subscribing to the channel will ensure you don't miss future videos on health and well-being topics. And sharing this video with friends or family members who might benefit could truly make a difference. I'd also love to hear from you. Have you experienced something like this? What steps did you take? Sharing your experiences in the comments below can help others feel less alone and offer valuable insights. Let's support each other. Take good care, dear friends, and I look forward to connecting with you again soon.